So I decided to become a psychologist when I was working as a writing mentor for underserved kids in the New York City school system. I saw kids who were dyslexic, who were being abused, who were just scared to speak, to express themselves. And I'm saying, my God, they're not getting the services that they need. We need psychologists involved. So I said, you know what, screw it. I'm going to go back and get my PhD in clinical psychology and I'll work with these kids. What I didn't know then is that 17 years later, I would be over $420,000 in debt and struggling to make a living.
So how does one become a psychologist? This is a very long process. The first thing would be that you would need to get an undergraduate degree or an equivalent of that. And then you have to get your doctorate from an accredited program. In your fourth year, you will apply for your internship. An internship is a full-time position. Then you need to get postdoctoral hours. In New York State, you need to get 1,750 supervised postdoctoral hours. Once you've submitted all the paperwork and all the fees, then you can get licensed.
Becoming a licensed psychologist takes 10 years or more of education and training. It's not just a degree in learning how to say to somebody, how do you feel? When I decided to go back to school for my PhD in clinical psychology, I had to get research experience. I had to get clinical experience. And because of my own learning disabilities, I had to record every one of my classes, which I would then transcribe and then study from that. So I didn't have time to work, so I was taking out loans to live. The unfortunate part was that I got sick. And I was not able to do anything but go to doctors repeatedly. I was really struggling. I had to pay $3,500 while not taking classes just to keep my status open in the school. And as a result of that, put me in tremendous debt.
There are many, many challenges to being an early career psychologist. Debt is the #1 issue. Graduate student debt for PhDs is around $75,000, and for PsyDs it's getting closer to $125,000, which will only be accruing in interest as you move forward in your career.
Many of these programs are demanding, and you're a full-time student, and if you're not working, you have to take additional loans to cover any gap in order to survive.
You could easily graduate from an accredited, high-quality program and have $250,000 in debt. And because of that, it can really completely disrupt your plans to buy a house, have children, have a family.
When my health improved and I was able to go back to work, I got a job at a community mental health center, and that's where I did my internship and my postdoc hours. You know, the clinic provides valuable services to populations that are high risk and low income. Unfortunately, when a client misses an appointment, insurance companies don't pay.
So generally speaking, in private practice, there is the idea of if you don't show up to your scheduled appointment and you don't let me know within 24 hours, you will still be billed. However, in the clinic, it doesn't work that way. I can come in for 8 hours and get paid nothing for the day, and that's really frustrating. When I talk to other colleagues who work in other places and I say, yeah, I see 50 people, some of my coworkers see 80, they give me this look of shock, like, what? How is that possible? How are you guys functioning? How are you helping your patients? And I have the same questions. So it's a very difficult balance of giving care while at the same time being able to make enough money to live. And the reason why I chose to work at this clinic is because I am working towards my licensure, and if word were to get out that I question policies or how different practices are done, I don't know if that could jeopardize my job at the clinic. I'm not sure if it's a risk that I'm willing to take.
I'm a licensed clinical psychologist. My focus is on adolescents with suicidal ideation. and trauma and abuse histories. I decided that I wanted to be the best therapist that I could be for my patients because I felt that the kids that I worked with deserved the best. And if I wasn't going to get the highest degree, they weren't going to get the best. So I decided to get my doctorate. And while I was doing that, my husband and I got pregnant. And I had my first daughter on my first day of grad school. Then the internship process, they made me apply to 25 different places. It cost me like $3,000 that I didn't have. And so we had to pick up and move all the way to Orange County. One of my fellow interns said she didn't have enough money to eat. And I'll never forget my supervisor said, well, you could apply for food stamps because here you probably make little enough. I was still taking out too many loans and leaning on my husband's income. Then I got my postdoc, so then I had to move again. More money, more loans. Kids had to start a new school, so my poor oldest daughter has been to a new daycare every year for life. And I feel guilty because that's all because of something I wanted. When I got my job out here, that's when my new boss started sexually harassing me, staring down my shirt, and at one point he cornered me in an office and shoved me and threatened to hurt me. And when I told HR about that, they told me I just thought he shoved me. So people get away with treating us this way.
For a field that is about teaching people how not to be abused, it's really abusive. And when I have a coworker come up to me and ask to borrow money because they need to buy a sandwich to eat because they haven't gotten paid, that's pretty sad.
I regret becoming a psychologist depending on the day. I could be doing something else for like a very similar amount of money with no amount of loans and without the heartache and the stress and the abuse. Nobody calls me doctor or anything. I don't see the point in having this degree anymore. My dream used to be that I was going to offer pro bono therapy to these kids with trauma. And what makes me the most upset is that I have to charge so much. I can't afford to do what I set out to do.
The people who make the laws are either not paying attention to this or don't think it's a big deal because people aren't standing up and saying this is a problem.
Everything that we do is defined by laws about how psychologists can practice and how our funding goes. And yet we're not really trained about how can we advocate with our legislators for the best interests of people that would like to have our mental health services and for ourselves and our profession.
Have a good one.
All right, take care. Bye-bye.
There's a part of me that says, well, leave this career. This is ridiculous. But when I see change in people, when I see that what I'm doing with somebody is making a difference in their lives, I keep showing up. I keep showing up.